Hi, my name is Amanda and I chose to do lipids, also known as fat, for my macronutrient video. Fats are very important for the human body to do many different things. Dietary fats are broken into three categories: triglycerides, sterols, and phospholipids. Now, triglycerides are further broken down into saturated and unsaturated fatty acids. Saturated fatty acids have no double bonds, allowing them to be tightly together and at room temperature are a solid form. Examples of saturated fats are we can find in pork, in beef, butter, cheese. Saturated fats are bad fats because they increase the LDL levels, which LDL is low density lipid levels, bad cholesterol. Saturated fats are no good. They increase our risk for cardiovascular disease in the long run. Unsaturated fats, however, are considered healthy fats. Those are olive oil, avocado oil. Unsaturated fats lower our LDL levels, which is good. So, unsaturated fats, however, have one or more double bond, meaning they can't fit together tightly, which is ideal for cell communication. So, one of the things that unsaturated fat does is it allows nutrients from the food that we consume to go through the cell membrane and allows to communicate through with other cells. So unsaturated fat is needed for cell communication. That's one of the things our body uses fats for. The next thing is very simple. It's a source of energy. Usually people think about carbs for source of energy. Our body also relies on fats for sources of energy. Our body, when we consume fat, our body may store some excess fat in our body for later use. It converts it into triglycerides. This is mainly used for our low intensity exercises. Our body will rely on fats, stored away fats for energy. The next thing I'd like to talk about is how lipids are used for absorption of vitamins. So, there are 4 fat-soluble vitamins. We have vitamin A, vitamin D, vitamin E, and vitamin K. Now, these vitamins rely on fat for our body to be able to absorb them. Vitamin A is needed to maintain our immune system. It's also needed for good vision. Vitamin D helps in the absorption of calcium, magnesium, phosphate, and also, of course, our bones. It helps our bone density. Vitamin E helps protect our cell membranes, while vitamin K is used with other things in our body to aid in blood coagulation, as needed, of course. So, fat is important in the role of absorption of fat-soluble vitamins, A, D, E, and K, and all 4 of those vitamins are needed in our system. Now, one of the essential fatty acids that we need to consume. So it's essential because our body cannot make it on its own. We must consume linoleic acid in order for our body to have it. What includes linoleic acid? Omega-6. Omega-6 can be found in soybean, corn oil, some meats. Again, it only can be consumed. Our body does not make linoleic acid. Linoleic acid is needed to produce that barrier for our organs. So when I say barrier, I refer to epithelial tissue. So linoleic acid is needed in the production of epithelial tissues. Epithelial tissues line our blood vessels, our skin, and it also lines our organs. So fat is needed. So the omega-6 fatty acids are needed to help protect our organs. Also, there's studies that show that omega-3 fatty acids improve joint function in people with rheumatoid arthritis because it aids in the decrease of inflammation. Now, going on to sterols. The most common one that we tend to consume is cholesterol. We find these mainly in animal-based foods, so eggs, meat, milk, things like that, in that nature. Cholesterol is needed for our cell membranes, and it helps repair and form new cells. Again, fats are needed for cell communication. As we can see, it's needed to form and repair cells and form new cells. So when we talk about lipids, it gets intense. There's a lot of things that lipids are needed for, but source of energy, it protects our organs, cell growth, cell repair, cell communication. It absorbs vitamins A, D, E, and K. Fat is needed in our daily diets. And that's all. Bye.